see a lot of diverticulitis in the descending colon, sigmoid colon. I think this may have been one of the only times I've seen it in the transverse colon. It was only this one diverticulum. I don't know if you can see my cursor or not, but there's this one diverticulum, and there was a little bit of fat stranding around it. There was really nothing else in this abdomen, and it also, matched the symptoms pretty well. So I'm pretty convinced that on the coronal and sagittal reconstructions too, it was pretty convincing that there was just a little bit of wall thickening around that single diverticulum. Appendicitis. I've seen the appendix going into hernias before, but this is the first time I saw it strangulated. You can see on the coronal that there's an appendiculus in the base of the appendix, but it wasn't actually obstructing. The rest of the appendix is normal until you get down to the tip of the appendix, which goes into a right inguinal hernia. And on the axial here, you can see that it's pretty inflamed. It was about 1.5 centimeters, and that matched the symptoms as well. The patient didn't have a previous diagnosis. They just came in the usual, I don't know, mental status changes or something. It was something completely unrelated, and I talked to the doctor about it. He didn't know that the patient had a history of anything. But on multiple images, it was pretty clear that the right sulcine gyri were abnormal compared to the left, pretty much going all the way down. It was hard to find normal sulcine gyri on the right side. So I never saw an MRI for it. I suppose the MRI would be even more convincing. Other than polymicrogyria, I'm not sure what else it could be. This is an Aunt Minnie enlarged, irregular kidneys with all these multiple fat density and lesions. So the bilateral multiple angiomyolipomas of tuberous sclerosis. Thought that was good. I hadn't seen this probably since residency. And here's another appendicitis. Just when you thought you'd seen all the variations of appendicitis, I'd never seen one associated with mycotic aneurysm. This is the appendiceal tip lying next to the right common iliac artery. And as we scroll down through multiple images, you can see the appendiceal tip and all the inflammation around it. And this actually is the aneurysm here. You can see this aneurysm, the normal, well, I should say it's not normal, but the opposite side, the common iliac artery is over there. So this is the appendiceal root, and then this is all inflamed appendix, and this is enhancing mycotic aneurysm. These are pretty uncommon in anybody. I guess we've seen a couple of small bowel, definite small bowel torsions. I think this is the only one I've seen where the SMD was really, clearly obstructed. You can see on this series as well as on other ones, you could see it just came right down to a point that was completely blocked, and the proximal mesenteric veins were dilated. Of course, a lot of edema and fluid. What makes this one more difficult is that it was actually during pregnancy, so everything was bunched up, and of course it becomes even more of an emergency then.